Hello guys, so today we're going to be talking about statin drug. Why statin? Why the doctor decided to put you on a statin? So your last visit to the doctor, he gave you one of the statin drug. Basically, he looked at these guidelines, 2013 ACC AHA cholesterol guidelines. That's the most updated guideline. So they follow this diagram, and based on the question, the answer you answered, they will decide whether to put you on statin or not. So let's start from the top here. It says clinical ASCVD, which is if you have a clinical risk for cardiovascular disease or atherosclerotic vascular disease, but let's just say cardiovascular disease. So if you have a risk, or if you have an event, actually, that means if you have an event for cardiovascular disease, like say you have an MI, stroke, or TIA, or something like that, then you're definitely going to be on a statin. The question is it going to be high intensity or low intensity? I mean moderate. There is no low intensity in this guideline. So it's either high or moderate. Well, if you a younger guy, less than age of 75, you're probably going to end up taking high intensity statin. If you are older than 75, then you're going to be on moderate. So that's in case you already have a confirmed case of cardiovascular disease, like I said, MI, myocardial infarction, or whatever. But say you don't, you're a pretty healthy guy, you never had any cardiovascular event, but your LDL is 190. So your LDL, that's what they call the bad cholesterol, if you will, which is the low density lipoprotein. The reason why it's bad, but I don't know, they call it bad. The reason why, because most of it is cholesterol. Only like up to, I think, 70 or 65% of that LDL is cholesterol and the rest is protein. But if it's HDL, which is the high density lipoprotein, that's better because it has more protein. Now let's say you did the blood work, you looked at it. I'm sure you guys are familiar with that LDL, and it's more than 190. Then you're going to be on high intensity statin for sure. Say you don't have clinical cardiovascular disease, you LDL is less than 190, but you are diabetic. So if you have diabetes, it doesn't matter, type 1 or 2, and your age between 40 to 75, yes, you're going to be on statin. The question is it going to be high intensity or moderate? Well, that takes us to something called the 10 years estimate cardiovascular risk. If your 10 years estimate cardiovascular death is more than 7.5, then you're going to be on high intensity. If you are less than 7.5, then you're going to be on moderate intensity. So right off the bat, if you don't have any of that, but you're diabetic and you are the age 40 to 75, you're most likely going to be on statin. And actually most likely going to be on high intensity statin. Why? Because if you plug your numbers to calculate that 10-year risk assessment, you're most likely going to score more than 7.5. You're probably going to be like 20 or 15 or 17. Very, 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 very rare cases where somebody with diabetes and he's like in his 60s or 50s, he scores less than 7.5. Well, if you do score less than 7.5, then you're going to be you're still going to be taking statin, but you're going to be taking the moderate intensity statin. If you don't have any of that, then you're not going to be taking statin. We talked about high intensity statin, moderate intensity statin, and here it says low intensity statin, but it's not exist on the guidelines, so there is no use for that. However, if the doctor do decide to put you on high intensity statin, so you have a cardiovascular event or you are diabetic and your 10-year risk assessment is over 7.5. What is the 10-year risk assessment? It's very easy. You can just go to Google and put 10-year risk assessment, and you click on the page, and it gives you some questionnaire. You plug in your numbers like your age, your gender, your systolic blood pressure, your triglyceride. You just put the numbers in, and it calculates it for you. It tells you what is your 10-year risk assessment, and we'll try to do that in another video. So say you're diabetic, right? Or even if you're not diabetic and you have 10-year risk assessment of more than 7.5, then you're going to be on a statin. The question is it high or low? These are the difference. So if you have a cardiovascular event, so you're probably going to be on a high intensity statin, which is Lipitor and Rovastatin and Crestor. These are the the generic name for it. So atorvastatin 40 or 80, that's high intensity. Rosuvastatin 20, 40, that's the high intensity. But if there's no need for you to be like, if you're diabetic, age 40 to 75, and your risk, 10-year risk assessment is less than 7.5, then you're gonna be on the moderate intensity, which is listed here. So if you notice, it's the same drug, atorvastatin, rosuvastatin, but less dosage. If you look here, 5 to 10, that will make moderate, but 20 to 40 will make it high. Atorvastatin, 10 to 20 will make it moderate, but 40 to 80 will make it high. Well, the question is, what about simvastatin? It's 20 to 40. Well, if we do 80, that will make it high? No, it will not. The reason why, because, and it's same thing for lovastatin, it's 40. What if we did 80? We'll put it here? No, that's not going to happen. These are the only two guys that make high intensity statin. The reason why, like for example, if you took that statin, simvastatin, sees 20 to 40, and you try to give 80, you're going to get more side effect of the drug, a little benefit, and you're not going to be on the high statin therapy. Why? Because these two guys can reduce your LDL by more than 50%, 50. Simvastatin, even at the highest maximum dose, the most you can get out of it is like 30%. It's not going to knock it down. It tells right here. Actually, it's right there. It knocks it down by 30%, but no more than 50%. But these are the bigger guns. Look at these guys. They knock it down over 50%. Okay, and then you get these little guys right here, low intensity statin, which is simvastatin 10. Yeah, from simvastatin 10, if you go up to 20 or 40, you're in a moderate intensity. But if you take it to 80, it's not gonna get you anywhere. So that's why if your doctor had you in simvastatin 80, you should have asked him, like, why am I taking 80? Doc, it's not in the guidelines. I would question it. The other thing that I would question is low intensity statin. These guys right here, they're not in the guidelines, man. If you look back in the guidelines, no place in therapy. It's only high, moderate, high, moderate or high. So where does the low intensity came from? I don't know.